Do you have many men coming to you to talk to you about hair loss and balding?
Some men do. I think one of the ways that men talk to me about it is one of the common medications for that is finasteride,
Right.
or sold under the trade name Propecia. And so they want to understand some of the risks of that. And so, when that's medicine was approved for hair loss, they, again, because people are going to take it are usually in the reproductive age, they did randomized placebo-controlled trials to look at semen quality. And it turns out that it didn't meaningfully impact things. Maybe it went down a little, but not a lot. But in sort of post, analyses of some of this, and now seeing lots of patients coming in, we do see men that are on finasteride. Some of them are more susceptible. And so one of the interesting things about trials is there's, kind of inclusion and exclusion criteria, right? Not everybody can be in it. And so if men had sperm counts that were too low, they weren't invited to be in these trials. So for men that, don't have as much reserve as others, I think they may be more susceptible. So that's one of the risk factors of finasteride. The other thing in addition to reproductive health is sexual health that I deal with a lot. And there's also a concern that finasteride impacts sexual function in men too. So, we have these discussions. I've had some men that come in after having been on finasteride and have, different issues with sexual desire, low libido, or erectile dysfunction. And so then we, work through an algorithm to try and improve that as well.
This is one of the things I think about a lot because I don't want to have a receding hairline, and I also don't want to have a hair operation or anything like that. But when I hear about some of these testosterone replacement therapies and such, my big concern is that if I take testosterone, maybe not now because I'm, probably don't need it right now, but maybe when I'm a little bit older, which is when I assume one would start taking it, maybe when I'm about 50-ish.
On average, but there are younger men that are on it as well.
For what reason? Just because they're low on... What's the sort of symptoms that have caused them to take it?
Well, I think there's, with all things, there's a bell-shaped curve. So some men are a little bit lower. Some have genetic conditions. There are some more nefarious testosterone prescribers. So even though men have a normal level, they're offered testosterone to kind of get in these kind of testosterone clinics. And some men, if kind of look at data, maybe 10 to 20% of, high school athletes have experimented with testosterone. And if you stay on that too long, it can really shut down your own axis. So if you take exogenous testosterone, so like testosterone injections or gels, your body stops making it. And the longer you're on it, the less likely your body's able to sort of restart. And so for some of these men, poor choices or, whatever, they've been on testosterone for a while and they can't ever stop.
I don't know if you've ever had any experience in it, because I know you focus predominantly on male health, but I've had a long conversation about contraceptive pills with my partner because she said this publicly before, that she was on a contraceptive pill for a long time. And everyone's relationship with contraception is different. But after taking it for 7 or 8 years, she came off it and her period didn't occur. So she really struggled with that for a while previously. And it made me really, it illuminated the fact that when we start messing with the chemical balances of our body using pills and injections and other things, we could do pretty long-term and or permanent damage to ourselves. And there's no real such thing as a free lunch, is there, in biology and chemistry?
Yeah, I think that's what it comes down to. I think a lot of people have said that if they tried to get the pill approved now, it would be a much different process and unlikely to succeed for those kind of reasons.
If I have low testosterone, and I come to see you, what is the typical way of getting a testosterone replacement therapy? Is it a pill? Is it an injection that I have to take? I know that it's quadrupled according to the data in the US since the 2000s, which is staggering. But how are people taking testosterone?
So there's lots of different ways that it can be taken. I think one thing, again, we talk about all the risks. So fertility would certainly be a big one. So if you come in your 30s, I'd ask you about your reproductive intent. So if you have a low testosterone and you're interested in having 4 kids, I wouldn't start you on testosterone directly. There's some off-label things, so medicines that we kind of repurpose to help increase your body's own testosterone that we would start with. But assuming that, let's say you're in your 60s, you're not interested in fertility, then, there's gels or patches that you put on every day, testosterone gel or patch, because that can work well. Probably 10 to 20% of men don't absorb testosterone that well through the skin. The other thing to be aware of is that there's a risk of like transference, like to your partner, or to anybody that kind of touches your skin. So if you have young kids, just to sort of be aware of. But as long as, you put it on, let it dry, put clothes on over it, it's not a big risk. Again, and also have to be, I guess, mindful of laundry as well. So, gels, patches are one. There's injections that you can do every usually 1 to 3 weeks on average. There's testosterone pellets. So these are pellets that have testosterone that are kind of slow release. So they're just injected. We kind of implant them under the skin, usually in the hip area, and those last probably 3 to 6 months. There's longer acting injections. So those are very common in Europe. They're kind of gaining steam in the US, but those are injections that last probably 10 weeks or so. And then there's a new oral therapy. So there's an oral form of testosterone that's available as well.
I was quite confused on this subject of hair loss and testosterone because I couldn't figure out if low testosterone causes me to bald and have a receding hairline, or if it's high testosterone that causes me to bald and have a receding hairline, or if it's both.
I mean, it could be both. I think usually we think about it as higher levels.
Okay. It's funny because I've wondered before whether me doing a lot of exercise, which is, I guess, increasing my testosterone levels, is going to accelerate my balding and receding hairline.
Anything that's good for your heart should be good for your hairline.
Okay.
So I would exercise. I think that's good.
But what if I'm doing like Ironmans and 1,000-mile runs and all that kind of thing, which you see in certain groups?
So I don't know that I do think it's possible to over-exercise. I don't know if it'll affect your hairline, but I think
my testosterone levels?
It can affect testosterone levels. I do think that it's, when you kind of exercise to the point of exhaustion, we do see declines in sperm counts as well. So hormone levels can certainly be affected.
As my cortisol goes up, so my testosterone, I guess, goes down?
Can go down sometimes.
Interesting. What about penis size? I heard you did some pretty landmark research which suggests that the length of a man's penis is increasing decade over decade in terms of men that are being born and boys that are going through puberty.
Yeah, so this study also got a lot of attention. So, similar to how we've tracked testosterone levels over time or sperm counts over time, for different reasons, investigators have measured penile length, to kind of give normative data across different populations to understand how different surgeries or conditions may affect penile length. So, we looked at, all the studies, and there were dozens. And so we kind of pooled all that together. And this was tens of thousands of men, and just looked at sort of average penile length over time. And so, again, based on some of the data on semen quality, we would have expected things to get shorter over time. And also because we're more obese now, the way that penises are measured is you kind of pull the penis on stretch and use a tape measure or some sort of ruler or measuring device. So if there's kind of more gut, more fat, in theory, length should be a little bit shorter now than it used to be. But it turns out, at least when you measure erect penile length, that penises are longer now than they used to be. And so over the past 30 years or so, they've probably gone up about 25%.
Why?
I mean, it's a good question. I think one hypothesis we had, kind of looking at sort of different endocrine, abnormalities and changes in puberty, is that if men go through puberty or boys go through puberty earlier, that tends to correlate with longer penis length. And so if we are shifting puberty, again, through these different environmental exposures, maybe that is leading to, changes in genital development. And this may be one of the consequences of it.
Does this have any upstream implications for sex?
I think that, the numbers we're talking about shouldn't be, kind of enough to make a big difference. People, as this study came out, we talked about, very enterprising patients kind of reaching out, sending emails. Some people hypothesized that this was kind of natural selection. So it's hard to know. But again, it's a very short period of time. So it's hard to believe that there's, that's kind of at play.
Do you have many people that come into your practice that are struggling with erectile dysfunction?
Yeah, so that's another very common condition we see. If you look at men over the age of 40, over half have some trouble with erection. So very, very common. Hundreds of millions of men all over the world are afflicted.
We don't talk about this much. What is the cause of this? And are you seeing it increase over time, the prevalence of erectile dysfunction?
I mean, I think the rates are going up. And I think, the risk factors, are the same risk, largely the same risk factors that affect heart disease. So, diabetes, obesity, high blood pressure, high cholesterol. Minority of these conditions can be caused by low testosterone. Sometimes the outcomes of, surgical treatment for pelvic cancers as well. But by and large, it's vascular. It's a blood flow issue.
Because I used to think it was more of like a hormonal thing or a psychology thing, like, sexual anxiety or some kind of, change to our testosterone levels is causing us to struggle with getting erections now. But you're saying it's about.
So I think, psychogenic used to be thought of, like you're saying, as the kind of the primary etiology. And maybe for some, populations, it could be a little bit more common, but generally for most men, sort of all comers, it's going to be a blood flow issue, a vascular, organic cause.
And how would you go about treating erectile dysfunction?
So there's a lot we can do. We do want to, kind of reverse anything that we can, kind of understand where the man's coming from, find out if there's, new relationship or other kind of factors. For men, like, you're suggesting that we do kind of suspect a psychogenic component, work with sex therapists as well. But for other men, I always like to be very positive. It's like to say, as long as you have a penis, we can always make it hard. So there's a lot that we can do. So usually we start with pills, like Viagra, Cialis.
Does that work for people?
It works probably 60 to 70% of the time. So that does work well. Even for men with a psychogenic cause, sometimes it can kind of help reset the system a little bit, convince them and their body that everything is working well.
Like a placebo effect.
Well, I think to some extent, but even more than that, because it does work. It does help. And then I think once they kind of regain that confidence, if there was some sort of traumatic event, traumatic relationship, it can help improve things. Pills aren't enough, or they don't like those, or they have side effects from those. There's other therapies. So there's medicines you can actually put in the tip of the penis, like a gel or a suppository. We can teach men to give themselves injections in the penis.
Oh, I just got a shiver down my body.
There's certainly a kind of a psychological sort of fear of that, but it does work well. Probably works 80 to 90% of the time. There is something called a vacuum erection device. So it's like a plastic cylinder you put over the penis. It sucks blood into the penis, kind of treats it like a balloon. And then you put a band at the base to trap blood inside. And there's even surgeries we can do to put a device inside the penis. So whenever a man wants to be hard, he can be hard.
I didn't know there was surgery you could do.
There's a surgery.
What does that do? It puts a...
So there's two main flavors of it. There's, or forms, maybe that's a better term. There's one called a malleable, so it's bendable. So it kind of puts this sort of bendable metal. It's a metal core with sort of a plastic kind of covering. So when they don't want to have sex, you bend it down. When you're ready for sex, you bend it up. Or there's inflatable versions. So whenever you're ready for sex, there's basically a pump that goes in the scrotum, and you just pump it up. It moves fluid into the cylinders, and you'll get a rigid erection.
Is that increasing in popularity?
I think, that it's made by a few manufacturers in the U.S. or in the world. So I think the data is not as freely available. I mean, in my practice, I've seen more and more of it. We're seeing more patients come in. I also say that, my practice is getting a little bit more mature with time as I get older. And so, naturally, more patients kind of hear about these different things, but it does work well. I always say it's a self-selected population, right? We don't hold men down and force them to get it, but generally they're very happy. Probably 90% of men are very happy. They'd recommend it to their friends, partners very happy, recommend it to other couples.
And you press a button and you get you can...
It's a pump right now. They are working actually on either a fob or like a phone app that'll kind of automatically inflate it to make it a little easier for patients.
I had no idea. It sounds like sci-fi or something. It sounds like it's it sounds like something you might see on like a YouTube video that people are working on in like 20, 30 years time. But to know that men have that installed now is amazing. Yeah.
It's very common. The youngest patient I put it in is about 20. The oldest is in his 80s.
Is it seen as like a last option in that menu of options that you presented there, where like the first option is probably Viagra, and in terms of popularity, is it a last port of call?
I think for a lot of men, it's the most aggressive, but some men don't want to do, like you had a reaction to the injection. I think that's a very common reaction. There are certainly some advantages to it compared to others. For Viagra, for example, even though it's obviously the easiest, it's a pill, there's some side effects with it. And there's also, a lag time, right? You have to take the pill, wait an hour, wait 30 minutes, something like that. Whereas this, the penile prosthesis, if you just pump it up, it's ready to go in seconds. So it can be very spontaneous. So patients like that, some patients don't, they have other medications, so they can't take pills. They don't like some of the other kind of intermediate options that we have.
Shockwave therapy for erections. Does that work, and what is it?
So the idea is that, as kind of the name implies, you're sending shockwaves into the penis. And the energy induces kind of some micro trauma, which induces new blood vessel growth, is the hypothesis. And so, the hope is that with, getting better blood flow into the penis can improve the quality of erections. So there have been some studies that do show benefit. It's still considered experimental because I think the data is not yet conclusive. But I think for men with milder forms of erectile dysfunction, it can help, maybe the men that are on Viagra or sometimes on Viagra, maybe we can get them off those pills. But I think we need more data to kind of understand really the best target population for it.
You talk about pelvic floors as well. When we typically think about pelvic floors, we tend to think of women, things like these Kegel exercises that people talk about. But is it important for us to think about that as a man as well, our sort of pelvic floor strength and our pelvic floor muscles?
I think in some conditions, I think if you're not thinking about it, it's probably okay. You're not having a lot of problems. Okay. But it can be a trigger for some men. So that can be an etiology of some different like problems with urination. You'd see men with very tight, pelvic floors, and they have a lot of urgency to urinate. They urinate frequently. It can also lead to scrotal pain sometimes as well, because there's a lot of muscles, as you're kind of pointing out, in the area. And sometimes if they're under tension, if they're not, properly kind of trained, and they can kind of trigger some other areas. And so for some of these different conditions, we do kind of work with pelvic floor physical therapists to train patients, how to, again, relax the area, strengthen the area, increase flexibility of some of those muscles, which can help.
Is it plausible that doing pelvic floor exercises will improve one's sex life?
I mean, I think that unless we're treating a problem, I would be very hesitant. One of my favorite sayings is the enemy of good is better. So if things are good, to try and get better, there's always going to be, like you said, there's no free lunch. There's always some trade-offs. So I think if you work on kind of over strengthening the pelvic floor, it could lead to some of these other dysfunctions. So you don't want to end up with a floor that's too tight or too tense.
Is there any correlation between these things, like your pelvic floor strength, your testosterone, your sperm count, and a variety of the different cancers that we see in men, things like testicular cancer and prostate cancer?
So I think with pelvic floor kind of strength, I think I usually kind of think about that as separate from cancer risk. But for testis cancer, one of the risk factors for that is some men are born without testicles in their scrotum. So that's a risk factor, an so-called undescended testicle. Low sperm counts are associated with testicular cancer. There was one study I know of years ago that looked at, comparing sort of sexual health to prostate cancer risk, found that men that ejaculated more frequently had a lower risk of prostate cancer. The thought was that, there was inflammation that you're kind of clearing out by frequent ejaculations. I think this study had men ejaculating 30 times a month and showed a lower risk. So that's a lot. But that was one study that said, at least it's not dangerous to ejaculate more frequently. But it's not something that I generally recommend to men to lower their risk.
If we talk about testicular cancer then, what are the common symptoms of testicular cancer?
Yeah, so usually it tends to be relatively asymptomatic. I think that, the classic symptom would be a firm, painless mass that men find in the scrotum. So if, there are screening guidelines, even though our preventative services task force thinks that, the utility of doing it for, reproductive age men to their scrotums may lead to more anxiety than actually, finding testis cancer, because it's such a rare cancer. So it's more likely a man's going to just worry themselves than actually, diagnose an early cancer. But the recommendation used to be that you would, once a month in the shower, kind of feel yourself. And if you feel something new or something abnormal, bring it to your doctor's attention. I certainly see a lot of men with this concern, do an exam, say, that's normal. Or if there's something that we're worried about, we'll kind of dive a little deeper.
What is the demographic that's most likely to get testicular cancer? Is it something that affects young people as well as older people?
It's usually mostly a cancer of young men. So I would say probably 20s to 40 is usually the kind of the prime demographic.
Why is it a cancer of young men? Is there any sort of physiological reason for that?
Well, I mean, it's a, reproductive age cancer. So that's the prime reproductive years. So it's possible that it kind of correlates with, sperm counts declining with older age. There is another slight increase for men in their 50s and 60s. But again, it is a very rare cancer. So I usually kind of quote probably 1 in 100,000 men are going to be diagnosed with it. So
1 in 100,000.
It's fairly uncommon.
But prostate cancer is more common.
Prostate cancer is more common. Yeah. So that we die, in the United States, probably at least 200,000 men every year. Some studies say that, if you live long enough, everybody will be diagnosed with prostate cancer. But again, most men with prostate cancer die of heart disease, just like every other man in this country. So most men, with prostate cancer die with it, not of it. So usually it's a slower growing disease, although there's some that are more aggressive, and that's why we screen for it and treat it.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.